Hello all. So today we are going to discuss about the circadian rhythm disorders. Let's straight away jump into the topic. So to begin with, what is generally a circa? Circa means a cycle of 24 hours. And this cycle has been disrupted in many kind of works. For example, the people who do the shift work, people who travel in a time zone when they travel across the time zones having jet lag, people who are exposed to the blue light, and in the nowadays the present scenario is everyone is watching the mobile phones which is having the blue light, and especially at the night time. The blue light exposure at the night time is the most common culprit. Next, the sleep wake cycle disruption. Now, these all kind of activities, they lead to circadian rhythm disorders. And what they lead to? They lead to premature aging, the metabolic diseases like type 2 diabetes, inflammation. The inflammatory markers like IL-6 have been found to be raised in the circadian rhythm disorders, and also the peoples are now developing the cancers. These all are the culprits. The shift work disorders, the jet lags, the blue light exposure, and the sleep wake cycle disorders, these all are the culprits for all the signs and symptoms what we are facing nowadays. Now, what is causing it? What happens in the normal physiology? Normally, when we are exposed to sun, the sunlight which is imparted on our retina, and it sends some signals to the suprachiasmatic nucleus in the hypothalamus, and it further entrains the circadian system to 24 hours of the day. It entrains the circadian system to the 24 hours in a day, which is further imparted as a physiological rhythm. Physiological rhythms have been imparted in certain parameters like core body temperature, autonomic nervous system, the neuroendocrine system. In the neuroendocrine system, we see there is a fluctuation in the level of the cortisols and hypothalamo pituitary and the adrenal axis. These all have been imparted as a circadian rhythm, right? Now, what is this? Zidgebers. Zidgebers. Zidgebers are nothing but, what are they? Zidgebers are any circadian system trained on the daily basis by some signals, like these signals which are in the form of the light exposure, meal timing, and activity patterns. These all are the signals which are called as Zidgebers. Now, what do these Zidgebers do? They maintain, or they help to maintain the circadian rhythm. Now, let us take the example of the light exposure. In the light exposure, what happens is, when the light is the sunlight generally, or the bright light is imparted in our system, in our retina, what happens is the melanopsin system is being activated there, and the photosensitive retinal ganglion cells receive it. Now, the blue light sensitive photopigment, which is called as melanopsin, it is generated in the inner retina, and which suppresses the melatonin during the daytime. So, during the daytime, there is decreased synthesis or decreased level of the melatonin in the blood, which imparts increased wakefulness and attentiveness during the working hours of the day. Right. Now, before jumping to the circadian rhythm disorders proper, let us first understand that what does the sleep wake cycle do to the body, or the normal physiology is there. Now, this table has been taken from the Harrison's book, 22nd edition of the medicine. Right. So, during the night time, what happens to the central nervous system? The central nervous system, there is, or in the fasting state, there is inhibition of the hunger. The hunger get disrupted. There is melatonin and GH secretion, that is growth hormone, increase in the quantity secreted more. The neurotoxic clearance happens. The neurotoxic clearance, it happens, and memory is consolidated. Memory is consolidated. That means a good sleep is necessary for memory to enhance. That is, we have to take a good sleep before the exams to consolidate the memory, right? Whereas in the waking time or in the feeding time, what happens to the CNS? Just opposite. The hunger gets stimulated. The hunger gets stimulated. There is foraging behavior, that is to accumulate, to search for the food, to live. These kinds of behavior gets activated. There is cortisol secretion. There is cortisol secretion is there during the daytime, and the neuronal activity. The neuronal activity gets increased. Now, in the muscles, what do happen? There is the oxidative metabolism. Oxidative metabolism happens in the muscles. But in the in the daytime, what happens? In the night time, the oxidative metabolism happens, and in the daytime, what happens? That the fatty acids uptake is increased, and the muscles undergo the glycolytic metabolism. In the night time, what happens in the adipose tissue? There is, in the adipose tissue, lipid catabolism happens, and there is secretion of leptin increases in the blood. Whereas in the daytime, what happens? There is lipogenesis, that means the fat is being generated, and the adiponectin levels, they increase. There is a production of adiponectins, right? Now, coming to the liver part, what happens at the night time in the liver? In the night time, there is gluconeogenesis, glycogenolysis, right? Mitochondrial biogenesis, and cholesterol synthesis happens, right? Whereas in the daytime, what happens? There is glycogen synthesis. That means the fats is being increased, and bile acid is also synthesized, right? Now, in the pancreas, what do happen? Pancreas at the night time, yes, since there is no sugar, so glucagon is being secreted, and in the daytime, generally during the feeding behavior, insulin is being secreted, right? So this is pretty easy to understand, right? Now, just coming to the circadian rhythm sleep disorders proper. Why do it happens? Because in the circadian rhythm sleep disorder, there is a mismatch between the subjective behavior and the physiological rhythm with the environmental light dark and the social activity rest cycles, or the light dark cycles, or the social activity and the rest cycles. There is non-concordance, or we can say there is a mismatch. Number first, we have to discuss the circadian rhythm disorders. Number first is delayed sleep phase disorder. Delayed sleep phase disorders. What is it? It means the sleep is delayed, and most commonly it is seen in adolescents. These people are called as night owls. So they go to bed very late, extreme late. So these are called as the night owls. And what is the therapy for these kinds of people? Generally, it is resolved when these kinds of patients, they go into their 20s, and resolves of its own, or we can do the behavioral therapy. The bright light therapy can be given soon after the patient woke up, right? And during the night time or in the evening hours, the dark room therapy can be provided, or we can give the melatonin. Melatonin can be given at the evening hours, which is several hours before several hours before going to the sleep before going to sleep. This will be helpful for this kind of patient, right? Coming to the next, that is advanced sleep phase disorder. Advanced sleep phase disorder, these kind of people have the right quality and amount, or quantity and quality of the sleep, but there is shifted time. Shifted time means these are extreme early birds. They rise from the bed too early, and these are generally the old people. And why do they rise early? Because there is increased sleep in the evening hours, or even the social, when these kind of people are in the social gathering, and at the evening hours they tended to sleep more early, right? What is the therapy for them? The bright light therapy at the evening hours is generally recommended, and also we can give the melatonin during the bedtime when these are patients about to go to sleep, right? Next is the shift work sleep disorder. Shift work sleep disorder, it can lead to multiple complaints like obesity, type 2 DM, and diabetes, the cardiovascular risk, the cancer, which we have discussed already. These kinds of sleep work disorder can lead to that. What is the treatment for that? Now, therapy for this is generally the intermittent bright light exposure during the night time and avoidance of the bright light during the daytime, so that the patient can go to sleep while working at the night, and melatonin can be given before the bedtime. Now, coming next to the irregular sleep wake rhythm, it is due to the damage to the suprachiasmatic nucleus, and also it seen in the when the suprachiasmatic nucleus is destroyed, or in the Alzheimer's disease we can find it. Now, what is the treatment for this? The same: increase the bright light exposure during the day, improve the sleep hygiene. Sleep hygiene is something very important in these kind of patients, to maintain the sleep hygiene, and the promotion of the social and physical activities. When these kinds of people are engaged in the physical and the social activities, then the disease is set to be removed or be treated. Next is the non-24-hour sleep wake rhythm disorder. This disorder is generally seen in the people who are complete blind, that is, the retina does not perceive any light, or lack all kinds of photoreceptors, right? So, what is the therapy in this kind of patient? We can use the melatonin for therapy. We can use melatonin plus melatonin agonists. These are being used. Coming to the jet lag. Jet lag happens in the people who travel across the 2 time zones. It can present as a multiple complaints, like the patient may complain of the insomnia. The patient complains of the daytime sleepiness, nausea, multiple joint pains, or muscle aches. We can say muscle aches. Fatigue is the most common complaint in these patients, right? So, what is the treatment for that? Now, for this treatment, we can advise the behavioral therapy, like timed bright light exposure, and avoid the bright light during the night time. And also, we can give melatonin just before going to the bed. Now, what is a social jet lag? This is also, that is, the compulsive wakefulness when the patient has the time to sleep, when the patient is about to reach the time to sleep. Due to the social compulsions, patient has to wake up. The therapy for this is also the same what we have discussed, right? So at last, I think, to conclude, the circadian rhythm disorders, they are the various manifestations of the disease. Like in the CNS, what we can find is the patient can land up in depression if the patient is having the circadian rhythm disorders. In the circadian rhythm sleep disorders, the CNS manifestations can lead to depression, the cognitive decline, and in the vasculature, if we talk about the vasculatures, it can lead to thromboembolic events. The thromboembolic events can be there. Also, patient can have hypertension and increased inflammatory cytokines in the body. In the muscles, what we have discussed is there is insulin resistance and sarcopenia occurs, that is the muscle mass get decreased. In the liver, what happens? It is dyslipidemia. Dyslipidemia occurs. Dyslipidemia can occur, and also steatosis can occur, right? Metabolic syndrome can lead, right? If we talk about the pancreas, hypoinsulinemia can occur. For adrenals, what happens? Patient can have chronic stress, and the hypothalamo pituitary adrenal axis can get completely disrupted, right? Now, in the adipose tissue, if we talk about, there is accumulation of a fat which is leading to opacity, right? If we talk about the hematopoietic system, what happens? It can lead to autoimmunity can occur. The patient can have various kind of diseases. The autoimmune diseases also ultimately it can lead to cancer, right? Fibroblasts, the fibroblast, it can lead to tumorigenesis, which can lead to cancer. And last but not the least, what happens in the intestine? The gut microbiome get disrupted. Patient can have steatosis. Fats in the stool, IBD, inflammatory bowel disease can flare up in these kind of patients. And most important is a dysbiosis. The gut microbiota gets disrupted. So I hope I have made some point clear about the circadian rhythm disorder, and if you like the video, please hit the like button and subscribe to my channel, and do please leave a comment. Thank you.